As Siobhan said, I'm going to talk about the Dementia Navigator service, which is a new service developed through the Quality Improvement Programme. As she said, my name is Bernie Collins. I'm Locality Manager for Memory Services in Newry and Mourne, and I'm Project Lead for the Dementia Navigator service in the Southern Trust. We have 3 Dementia Navigators who are all professional social work trained, one for each locality. We have Sinead in Armagh and Gannon, Sheena in C&B, and Stephanie in Newry and Mourne. And we also have 3 dementia support workers aligned, one aligned to each navigator. In addition, we have just recruited a 4th navigator, Catherine McCorry, who will be working with those people under the age of 65 with dementia. So what do? Well, the Navigator service provides a point of contact for all those following a diagnosis of dementia or who are presenting with memory difficulties and are awaiting a formal diagnosis. They are the contact for the people after their first clinic appointment at screening clinic and after their appointment at the consultant clinic, where they will receive their diagnosis of dementia being confirmed. The Dementia Navigator each provides information, support and guidance for patients, family members and carers coping with the emotional, psychological and physical effects of dementia, both pre-diagnosis and post-diagnosis. The service aims to counteract the negative impact of dementia and of a diagnosis and promote a recovery ethos of care. It connects with the person with dementia, their family and carers to a network of support services across the community, voluntary and independent sectors. So what do we provide? Well, first of all, the Dementia Navigator provides information packs to each person who attends clinic with dementia or their families. They undertake an assessment, which is a strengths-based assessment looking at supports and strengths. They give support information guidance to service users, and they inform people about locally based services in each of their localities. One of the first things that the navigators and support workers did at the start of the project was to scope local clubs, activities, etc. in each of the localities, and they've actually built up a directory for use with people with dementia and the carers, but it's also available to any member of staff throughout the trust if they have any queries about what's going on in their local community. In addition, we developed a personal wellbeing plan, and the navigators will offer this and undertake it with the person if they wish. They're involved in signposting and onward referral to other agencies as necessary. They also offer carers assessments, and the carers is part of their remit as well. And they facilitate group work sessions, providing post-diagnostic group work sessions in order to assist with coping and adjustment and planning for the future. So why was the service needed? Well, the number of people with dementia is rising worldwide, and in Northern Ireland by the year 2051 there will be approximately 47,000 people with dementia. The background to this project is that there was a gap within the services for a memory service navigator role, which had actually been identified in a consultation process regionally throughout Northern Ireland with people with dementia. The rising numbers of people with dementia has also drawn attention to the importance of a timely diagnosis and intervention, and this allows the person, first of all, to get appropriate help when needed, to receive information, care and support which improves quality of life, and to be supported to make choices and plan for the future with their family while their condition still permits this. At a local level, why was the service needed? Well, within the Southern Trust, people with dementia only accessed community memory services if they required statutory input, for example, a domiciliary care package or daycare or whatever. So there was a gap then for people who didn't actually require this level of support. I used a purpose to practice tool with the project team and head of service to establish what elements were needed to be considered in the implementation of the Navigator service. I also used a process mapping exercise to look at how a person gets into the memory service system. In analysing the process map, the timescales identified were an important contributory factor in highlighting what needed addressed. This showed that from the point of time the GP actually makes the referral to the time they're actually referred into the community memory team, if at all, could take at the very least up to 26 weeks and sometimes longer. And that left the patient and their carer and family with a lack of timely information and support at a time when they're dealing with a life-changing diagnosis of dementia. So what did we do? Well, while the process mapping exercise identified the time delays for people with dementia in getting into the memory service system, I also needed to quantify the numbers. Getting the right baseline data was very important in terms of the current service provision in order to show how the new service would make a difference. I used data for a specific time period. I used April 14 to March 15, and using a capacity and demand technique, I was able to do an analysis of the numbers of people attending first outpatient clinic appointments and compare these in relation to the numbers referred to the community memory services. As you can see from the graph, there was only a very small percentage of people actually referred into community memory service in the same year that they actually attended their outpatient appointment. So what else did we do? Well, as with any project, there are a number of things you have to do in getting it started. It was necessary to engage with as many staff and a variety of teams, services, carers, etc. as possible to give them information about Dementia Navigator service and to glean what they felt they needed from it. In terms of standard operating procedures, I used a standard operating procedure tool in order to inform referees of the process for referral into the Dementia Navigator service. This was to ensure consistency and to target appropriate persons referred, and also to ensure that referrals were actioned and processed in a timely manner. PDSA, which is Plan, Do, Study, Act cycles, which is an improvement tool and technique. I used a number of these throughout the project, which assisted me in terms of being able to analyse and reflect on the effectiveness of a particular task or action and adapt it accordingly. I used these in the development of an appropriate person-centred strengths-based assessment tool, also in the development of the personal and wellbeing plan, and in looking at and changing the referral pathway during the project. As I'd already alluded to, I used a process mapping exercise to look at how the person gets into the memory service system, and I've used this both before the implementation of the Navigator service and after. So did anything change? How do you know if changes have made an improvement, and how do I go about finding this? Whilst the new service is still in the early stages of development, there are early results which show improvement, which it is anticipated will be built upon. Using data for a 3-month period this year, which was April to June, which is the period that I had full figures for, following the implementation of the service, we can see that there is a substantial reduction in the length of time between the person attends their first outpatient clinic appointment and they're referred into the community memory service, which is inclusive of the Dementia Navigator service now. As you'll probably not be able to see, but it was over 300 days, the very longest period previously, and this is reduced to just over 80 days for the very longest period. This will improve, I've no doubt, given the number of referrals coming in, and when we have a full year's data to analyse, it'll become more apparent just of the difference it has made. Additionally, as with all new services, it's necessary to collect information on how the service is performing. This is both for the funders, obviously, but also for the service itself. We collect information on a monthly basis using a monthly performance pro forma, and the types of information we collect are, for example, the number of information packs given out, the number of onward referrals, carers, assessments completed, the number of personal wellbeing plans offered, etc. In terms of referral numbers, up until the 30th of September this year, These are the referral numbers for each of the areas. As you can see, in Armagh, Dungannon and Newry and Mourne, we have received and actioned 59 referrals for the Dementia Navigator service in those areas, and 55 in the Newry and Mourne area. And I suppose it's just bringing your attention to the wee man at the bottom there. As referrals to the Navigator service are referrals for us to help people basically to put the pieces together to enable them to live well with dementia. As we all know, information is empowering. So in terms of then the impact of the service, some of the feedback that we have got, the Navigators don't just work with people on a one-to-one basis, they also work in group work sessions, and they also have a remit in working with carers. In terms of 2 group work sessions undertaken by a Navigator and a support worker with residents with a memory problem or a diagnosis of dementia in a residential facility, the feedback from the participants has been very good. As you can see, one participant here said, "The Navigator and support worker listened to me and give me the time to talk. Every week we try something new. It's good fun." And in terms of a staff member in the facility, they pointed out that the activities improved motor skills, increased concentration levels, and helped confidence grow. Another area of importance, obviously, is with the carers, and as can be seen from this selection of comments, carers value the expertise and support provided by the Navigators. This gentleman, whose wife has dementia, and he commented, "I'm glad I was able to get talking to you about my wife's symptoms. It's a load off my chest." And for another carer whose mum has dementia, said, "I have heard so much about her condition from you and your visits. We want the best for mum, and having your contact number is a help." So as I said at the outset, this project was carried out through the Quality Improvement Programme. And at the outset, the Dementia Navigators all completed the introduction to quality improvement. And I also ensured that they received downloads from the slides from the e-learning that I've been doing throughout the project. And this was to keep them abreast of the QIP programme. Also, as part of the overall quality improvement focus, our 3 Dementia Navigator support workers undertook the Trust's Foundation in Quality Improvement Level 3 Award, and that was in terms of setting up a peer group support. And I know Jordan's poster is downstairs if any of you have had a look at it. So the impact of this has been that quality improvement knowledge and skill now exists within the Dementia Navigator service across all disciplines and across all 3 localities. And for contact information, there's just details for myself and the 3 Navigators in the 3 localities. Thank you.